everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on psoriasis. Now, psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, cold, etc. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints as well. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Sagar Makhija, who is an MBBS MD consultant dermatocosmetologist. He is part-time dermatologist at Century Rand Hospital Trust. He is also senior resident at Lokmanya Tilak Municipal Medical College, Mumbai, and currently practicing at Radiant Skin and Dental Clinic. A very warm welcome to you, Dr. Sagar Makhija.
Hello, everyone. Hi. Good evening to all. Yeah.
So, Doctor, it is such a pleasure to have you with us. And today, as we are going to discuss about on a very important topic, psoriasis. First of all, we would like to ask you, what is psoriasis? Psoriasis आखिर है क्या?
Yes. Basically, psoriasis is an chronic inflammatory autoimmune skin condition in which the healthy skins of the body are mistakenly affected by our own cells, which leads to increased cell proliferation and which leads to red scaly patches over the skin. So basically, it's an autoimmune skin condition जिसमें जो हमारी नॉर्मल स्किन है उसको ही अपनी इम्यूनिटी अटैक करती है एंड उसमें जो नॉर्मल स्किन रेट है अपना दैट इज 40 to 50 days, and every 40 to 50 days new skin gets produced. But because in this psoriasis the normal skin cells are affected, in 2 to 3 days we see new skin production, so which leads to scaly patches. Yeah.
And Doctor, even if it's a autoimmune thing, as you explained, what are the various causes? उसके अलावा और क्या कारण होते हैं psoriasis के?
Yeah. Basically, autoimmunity or immune dysfunction is the most common cause. Apart from this, the other causes are genetics. If someone in the family members or siblings or in the first degree relatives is having psoriasis, so there are higher chances the person can have psoriasis with the affected genes. Also, right now, the most important factors which are going on is an environmental factors, such as there are various triggering factors like you can say patients are very less exposed to sunlight these days, so this is also one of the factors. And like cold weather or winter season is a important triggering factor for psoriasis. Apart from this, various lifestyle factors like increased stress, obesity, diabetes, increased consumption of alcohol and smoking can also trigger psoriasis.
Doctor, who gets psoriasis? Is it contagious? अगर किसी के कांटेक्ट में हम आ गए जिन्हें psoriasis है, तो क्या
Yeah.
chances हैं कि हमें भी हो जाएंगे?
No, definitely not. So, ये common misconception है among the normal people कि if the patient is having psoriasis, so it can be contagious or it will definitely spread from it, but it is not contagious at all. It does not spread through touch or any clothes or anything. Apart from psoriasis, there are various other skin infections which are highly contagious, but psoriasis is not contagious.
Right. So psoriasis as per is not
Yeah.
contagious. Now, doctor, जितने भी skin infections होते हैं, allergies होती
Mhm.
हैं, उसमें हम देखते हैं कि
Mhm.
एक common pattern ये होता है skin पे rash हुआ, itchiness है, redness है,
Mhm.
scaling है.
Mhm.
अगर हमें
Mhm.
समझना हो एज अ लेमन कि हमारी स्किन में हो रहा है जो वो कहीं सोरियासिस तो नहीं, तो कैसे
Mhm.
हम समझ सकते हैं क्या कैरेक्टरिस्टिक्स
Mhm.
होते हैं सोरियासिस के, इफ यू कैन टेल अस?
Yeah, that's a very good question for the public. So in psoriasis, आपको एक स्पेसिफिक रेड कलर के पैचेस दिखेंगे बट एट स्पेसिफिक साइट्स, मोस्टली एल्बोज, नीज, जॉइंट्स पे, लोअर बैक एंड ऑल्सो इन द स्कैल्प इन द फॉर्म ऑफ डैंड्रफ। एंड ये आपके बॉडी पे या फिर लाइफ में अप्स एंड डाउन्स या फिर वो ट्रिगर होते रहेंगे, बट उसमें इचिंग कम होगी एज कम्पेयर टू अदर, यू कैन से eczema or other skin conditions which will be highly itchy, and
Mhm.
it can so we can differ such from other conditions.
Right. Doctor, we would also like to know if
Mm,
somebody is not taking good care of their skin, not moisturizing it
mm,
much. एक तो
yeah.
हमको ये लगता है कि स्किन का अपना एक मैकेनिज्म होता है ऑयल प्रोडक्शन का, सीबम प्रोडक्शन का,
Mm,
इट कैन टेक केयर ऑफ इट्स ओन। तो कई बार हम
yes.
लोग ये छोटी छोटी चीजें हैं जिसको इग्नोर करते हैं। एक स्किन केयर रूटीन बहुत ही बेसिक
Mm,
सिंपल मिनिमलिस्टिक सा,
yeah.
मॉइस्चराइजर लगाना, बॉडी
Mm,
लोशन लगाना, इन तरह की चीजों को हम स्किप
mm.
करते हैं। Can such practices also lead to psoriasis?
Yeah, definitely. So basically, the normal public should understand that in psoriasis, the skin becomes very dry and scaly. So moisturizer is a very important part of the treatment in psoriasis. So if the patient is applying moisturizer on a daily basis as a thick layer, mainly after bath, so this will help in prevention of psoriasis. Also, it will help to control psoriasis on a long-term basis. So मॉइस्चराइजर सबसे इम्पोर्टेंट पार्ट है सोरियासिस के मैनेजमेंट में। इवन इफ पेशेंट को सोरियासिस था या है, सो मॉइस्चराइजर उनको कंटिन्यूअसली लगाना है। एंड ऑल्सो द टाइप ऑफ मॉइस्चराइजर इज ऑल्सो इम्पोर्टेंट, and the moisturizer good in ceramides, good in shea butters will definitely help in psoriasis.
Right. Yeah, because market is flooded with
Mm.
moisturizers or
Yeah.
other skincare products, and on the name of skincare, we end up buying maybe like 10 bottles. We are also
Mm.
experimenting a lot these days, लेकिन कई बार वो consistency नहीं आ
Mhm.
पाती. So as a layman, when we go out to buy a particular product for skincare, we normally go buy the fragrance, the
Mm.
feel,
Yeah.
etc. तो इन केस ऑफ
Mhm.
सोराइसिस अगर इसको हम ध्यान में रखें तो किस तरह का मॉइस्चराइजर, आपने कहा कि शिया बटर या जो थिक थोड़े मॉइस्चराइजर्स होते हैं दे आर गुड, बट और कौन सी
Mm.
चीजें हैं जिन्हें हमें ध्यान में रखना है डॉक्टर?
यस। सो बेसिकली जो मॉइस्चराइजर्स होते हैं वो 4 टाइप्स के होते हैं। सो उनका मेनली रोल ये होता है कि देयर आर वन टाइप ऑफ मॉइस्चराइजर्स जिससे वो मॉइस्चर को बॉडी से बाहर जाने में प्रिवेंट करता है, प्रिवेंटिंग ट्रांस एपिडर्मल वाटर लॉस। सो इन सोरियासिस हमको ये चारों टाइप के जो मॉइस्चराइजर्स है ये कंटेंट्स में होना ज़रूरी है। जैसे कि देयर इज़ नोन एज़ ग्लिसरीन, देयर इज़ नोन एज़ पेट्रोलैटम, there are known as shea butters, mango butters, and ceramides. ये चारों moisturizers is very important to have, which will help in controlling psoriasis.
राइट, सो दीज आर द थिंग्स दैट वी नीड टू कीप इन माइंड। अगेन डॉक्टर, बहुत अच्छी खुशबू होनी चाहिए, तो ये सब जो चीजें
Mm,
हैं इसका भी ध्यान में
mm,
रखना पड़ता है, या बिकॉज एज अ लेमन वी वी आर सो टेम्पटेड विद
yes.
क्या फ्रेग्रेंस है, क्या अरोमा है?
Mm. Yeah. So, for if the patient, no, for normal public, aromas or scented moisturizers is okay. But in psoriasis, we tend to avoid such products. We have to give a very safe and you can say chemical-free and fragrance-free moisturizers, because such things, anything which can irritate the skin can trigger psoriasis. तो इस चीज का हमको ध्यान रखना होगा.
Right. So the bottom line is, in case we have psoriasis or any kind of skin infection or allergy, we need to go and consult
Mm,
a doctor so that we find out what is the problem, what is the cause, and applying moisturizer for a healthy skin barrier is very, very essential.
yeah.
Choosing the correct moisturizer is equally, important.
Mm,
And in case you have any skin condition, please go and consult a qualified dermat. They'll help you to find out the right kind of moisturizer or skincare products as per your skin type, as per your skin condition. So please do moisturize your skin. That's very, very effective and
mm,
important. Now, doctor, because we are talking about psoriasis, and a very common question people often ask, can psoriasis be cured?
mm. Yeah. So that's the first question which many of the patients, when they come to know about the diagnosis, ki they have psoriasis, so they keep on asking. can it can be completely cured? So the answer is simple that psoriasis can not be cured, but it can be controlled on a long-term basis with proper treatment and patients. You can say if the patient is following the treatment and also following the applying the moisturizer daily and following the rules and regulations, so they can keep psoriasis on control on a long term basis. It cannot be cured because it's an autoimmune skin condition, but definitely it can be cured on it can be controlled on a long term basis.
Right. Now, when a person comes to you with such symptoms or signs on skin,
Mhm.
which can, point out to psoriasis, are there any tests that you normally conduct, or just by clinical investigation, you're sure
Yeah.
that this is psoriasis?
Yes. So clinical diagnosis is the first thing which we mainly see in a magnifying lens properly, where we see there are red scaly patches with thick silvery white scales. That's the first thing for diagnosis. Apart from this, we can do a simple bedside test known as a Greta's test. With a simple glass slide, if we continuously scrape the skin cells, or you can say the white scales, we can see some pinpoint bleeding. That's a characteristic sign of psoriasis. Also, with dermoscopy, we can confirm the diagnosis, and also if we want to confirm it, and if there is a doubt, we can go for a skin biopsy also. But definitely, clinical diagnosis is important in this.
Right. And when you come to a conclusion that okay, this is psoriasis, then what are the treatment options that are available? Or doctor, are there
Mhm.
various types or stages of psoriasis as well?
Yes, yes. So, before starting a treatment, there is a classification of psoriasis. Also, there is a normal classification. If body surface area is less than 10%, if it's localized, we start with the topical, you can say with the creams and treatment. And if it's involved more than 10% of the body surface area, we can start with the oral medication treatment. So this is in terms of classification and treatment. Also, you can see basis on the sites involved, psoriasis also classified. Like in some patients, we can see that only scalp is involved, which is known as scalp psoriasis. In some cases, we can see palms and soles are involved, which is also very common these days, known as palmoplantar psoriasis. Nails can also be involved, known as in nail psoriasis, and in some patients we can see joints are also involved, known as psoriatic arthritis. So, in types of based on the sites involved, we can classify psoriasis. And regarding the treatment options, mainly we start with the topical treatment in terms of good moisturizers. Also, we use topical corticosteroids to suppress the inflammation and patches. Apart from this, we can use topical vitamin D analogs and also topical retinoids. And if we want to start with the medical line of treatment, we have various oral drugs available for us, which includes oral methotrexate, cyclosporin, apremilast, and also biologics, which helps in decreasing cell proliferation. Apart from this, there is a good treatment option available known as phototherapy, and so in terms of phototherapy also, we can see good response in patients.
Fair enough. Doctor, because you mentioned a very important thing, and that is the amount of area that is affected by psoriasis, is also an important point to consider while
Yeah.
you said, what kind of treatment has to be given. Now, for that, एक आम आदमी के लिए नॉर्मली क्या होता है, कुछ भी हमारे स्किन पे होता है, स्किन को लेके हम थोड़े लीनियंट भी हैं, तो हमें लगता है ये अपने आप
Mhm.
ठीक हो जाएगा, अभी एक दो
Mhm.
दिन की बात है, या मौसम
Yeah.
का असर है, और हम उसे थोड़ा
Mhm.
थोड़ा इग्नोर करने लगते हैं। फिर एक और बहुत बड़ा ऑब्सेशन हमें है, वो है होम रेमेडीज का, डीआईवाईज आजकल बहुत ट्रेंड है, देन वी हैव
Mhm.
these over the counter topical applications. So what normally happens before going and consulting a doctor, we'll start something at our home, किसी से पूछ लिया, अरे ऐसा कुछ हो रहा है, तो
Mhm.
उसने बोल दिया मलाई लगा लो, एलोवेरा लगा लो, तो हमने लगा दिया। फिर जब
Mhm.
ठीक नहीं हुआ, थोड़ा और एरिया बढ़ गया, तो फिर हम जाते हैं एक केमिस्ट शॉप के पास,
Oh,
और
yeah.
केमिस्ट से बोलते हैं कि कोई हमको क्रीम दे दो लगाने के लिए, देन वी कीप ऑन अप्लाइंग दैट क्रीम। अगर इनिशियली उससे कुछ फायदा हुआ, तो हमें लगता है कि बस हमारे
Mhm.
हाथ में कोई मैजिक क्रीम लग गया है। ओनली
mm,
आफ्टर मोस्ट इन मोस्ट ऑफ द केसेस ओनली आफ्टर वी रियलाइज कि ये ठीक नहीं हो रहा है और या बढ़ता जा रहा है या जो सिम्टम्स है वो बहुत ज्यादा परेशान कर रहे हैं इज व्हेन वी गो एंड कंसल्ट अ क्वालिफाइड डर्मेटोलॉजिस्ट. नाउ माय क्वेश्चन टू यू इज, because you mentioned about the area infected by or affected by psoriasis. मान
mm,
लीजिए एक छोटा सा पैच ही है, अभी अभी मैं डॉक्टर
yeah,
को दिखा देती हूँ, ट्रीटमेंट शुरू कर
mm,
देती हूँ, या फिर
mm,
मैं बहुत सारा वक्त डीआईवाई होम रेमेडी या ओवर द काउंटर टॉपिकल एप्लीकेशन में जाया करने के बाद डॉक्टर तक पहुंचती हूँ, तो इन दोनों
mm,
केसेस में ट्रीटमेंट कितना आसान या मुश्किल हो जाता है?
yeah. So अगर पेशेंट काफी होम रेमेडीज करके आ रहा है, एंड देर इज वन थिंग विच आई वुड लाइक टू लेट ऑल द पीपल नो दैट देर इज थिंग नोन एज कॉर्बनर फिनोमिनन. कोई भी स्किन में अगर कोई इंजरी होती है या उसको स्किन इरिटेट होता है, तो वहाँ पे सोरियासिस अपने आप डेवलप हो सकता है, पूरे बॉडी पे कहाँ पे भी. सो इस चीज का आप सबको ध्यान रखना होगा. बेसिकली अगर आपको होम रेमेडी स्टार्ट करना है, यू कैन जस्ट स्टार्ट अप्लाइंग अ गुड पेट्रोलियम जेली or some kind of aloe vera gel. Just if there is some, you can say, just there is some itching or some burning sensation. But it's always better to consult a qualified dermatologist with good level of, you can say, keratolytic moisturizers and topical creams. It can be controlled in a very starting stage only.
Right. And going for over the counter topical application, is it a good practice or it can make the thing worse?
It can definitely make it worse because based on the basis of, you can say, the skin condition or severity, we usually prescribe treatment. But the over the counter medicines, they have, you can say, very high potent steroids, and which can also damage the skin, and on long term use it can also, you can say, make the skin barrier worse, so this can also worsen the psoriasis.
बिल्कुल, तो इसलिए वक़्त नहीं ज़ाया कीजिए। अगर स्किन में किसी भी तरह का इन्फेक्शन, एलर्जी, इचिंग, स्केलिंग लग रही है, then please go and consult the correct person, which is a qualified dermatologist. Now, doctor, there are a few questions that are associated with what we are talking right now. उसमें से एक है, राजू पूछ रहे हैं, कोकोनट ऑयल के इस्तेमाल से क्या सोरियासिस में फ़र्क पड़ता है?
Yeah, definitely. So basically, the coconut oil, which will help in retaining moisturizer in the skin. So this is a good practice, especially in winters. The coconut oil definitely helps in psoriasis. You can either apply in the night, overnight, or in the morning. You can apply just before the bath. Yes.
ओके. रेखा टिर्के पूछ रही हैं, कैन सोरियासिस कॉज क्रैक्स इन द स्किन, एंड बाय व्हाट यू जस्ट सेड रिगार्डिंग द ट्रॉमा ऑन द स्किन, मुझे इसका बिल्कुल वाइसा वर्सा लग रहा है कि अगर स्किन में कोई क्रैक है या कोई ट्रॉमा है, देन देयर आर गुड चांसेस ऑफ हैविंग सोरियासिस, डॉक्टर.
Yeah, so basically, जो sites है आपके palms and soles, which are if patient is having some patches over the palms and soles, they should immediately consult a qualified dermatologist, and you can start the treatment, because in such patients, you can see definitely there is cracks over the skin, and which is very much painful also. So it's better to consult a doctor. Yeah.
Right. And doctor, what are the various treatment options available? How much time normally it takes to, heal
Mhm.
the psoriasis? और उसके बाद एक मेंटेनेंस थेरेपी भी होती होगी कि बार बार
Right.
ना हो, तो क्या वो
Mm.
रहता है?
Yeah. So basically, on the severity, the doctor starts the treatment, and if the patient is having very localized psoriasis, so just with topical treatment, it can be completely, you can say, controlled, and the response can be seen within 2 to 4 weeks, right? And if the patient is having, you can say, moderate to severe psoriasis, more majority of skin is involved, so we normally start an oral medication for it along with topical creams. In such patients, it takes minimum 4 to 6 weeks to see a good visible response, and normally the treatment is continued for minimum 2 to 3 months. In such, after 2 to 3 months, there you would see the disease is inactive, or it has gone in the maintenance phase, and the maintenance phase can be continued for next 3 to 6 months.
Fair enough. Doctor, we have this tendency again in our society where, in
Mm,
case of any issue, we do go and consult a doctor, start following the, prescription. But after a
mm,
certain amount of time, for example, जैसा आपने कहा कई बार 2 से 4 हफ्ते लगते हैं ट्रीटमेंट में, तो मान लीजिए 2 हफ्ते में ही मुझे लगने लगा कि अब ये ठीक हो गया है, अब मुझे प्रॉब्लम
yeah.
नहीं है, itchiness नहीं है, वो पैचेस
Mm,
नहीं दिख रहे हैं, and I'll eventually stop taking medication. This is a very normal, tendency we have without keeping the doctor in loop, विदाउट
mm,
इन्फॉर्मिंग द डॉक्टर कि हमने ये बंद कर दिया है. आई एम श्योर आपके पास भी इस तरह के पेशेंट्स आते हैं जिन्होंने थोड़ी दिन लिया फिर बंद कर दिया फिर हुआ, तो बिकॉज वी हैव
right.
द प्रिस्क्रिप्शन अगेन वी कैन गो फॉर द सेम
Mm,
मेडिकेशन एंड ऑल. तो
mm,
ये कैसे, मतलब ये कर सकते हैं और इट कुड बी डेंजरस, वी नीड टू फॉलो द प्रिस्क्रिप्शन.
yeah. So I think patients should ideally follow the prescription, and it's also dangerous on a long-term use because initially, if you're starting, you can say high potent steroids, but अगर आपने उसको long term तक continue किया, so you can see some skin side effects also. So if you're starting a treatment initially, so it's better to consult a doctor after maybe 10 to 15 days, and if the response is seen, the doctor can taper the steroids or any cream, and they would suggest a good moisturizer so that you can continue. एंड इससे आप उस सोरियासिस को आप कंट्रोल कर सकते हैं.
Dr. Makhija, many a times anything which is happening on our skin is a signal that something is not correct inside the
Mm,
body. There could
yes.
be an underlying medical condition. Many a
Mm,
times it's just a cosmetic concern. What
mm,
is it about psoriasis? मतलब सिर्फ ये एक कि डिस्कम्फर्ट है, बार बार इचिंग हो रही है, रैश हो रहा है, हमारा क्वालिटी ऑफ लाइफ हैम्पर हो रहा है, इट्स जस्ट दैट, और कोई अंडरलाइन मेडिकल कंडीशन की तरफ भी संकेत देता है.
राइट. आई थिंक दिस इज अ वेरी इंपॉर्टेंट क्वेश्चन ऑल्सो. सो जैसे हमने बताया कि सोरियासिस एक क्रॉनिक ऑटो इम्यून इन्फ्लेमेटरी स्किन कंडीशन है जो स्किन के अंदर से या बॉडी में अपने आप अंदर से वो डेवलप हो रहा है. सो जस्ट कि वो एक स्किन डिजीज है एंड यू कैन सेफली इग्नोर द सिस्टम और बॉडी इज नॉट राइट. सो पेशेंट शुड बी अवेयर कि एक इन्फ्लेमेशन हमारे बॉडी में या स्किन में हो रहा है, तो दे शुड ऑल्सो बी वेरी मच केयरफुल एंड फॉलो सम यू कैन से प्रैक्टिसेस कि वो इन्फ्लेमेशन कम हो. राइट. They should have a good healthy lifestyle is very important. Good amount of sleep, good healthy diet is plays a very important role in psoriasis. And apart from this, if the patient is having psoriasis, he can develop. It can also affect some nails, some joints, some internal organs on a long-term basis. It can cause. It usually causes inflammation in the body, so it's better to control it at an initial stage only.
ओके. अभी थोड़ी देर पहले डॉक्टर आपने एक चीज मेंशन किया था, दैट वाज अबाउट विटामिन डी, दैट विटामिन डी इज
Yeah.
आल्सो वेरी प्लेज अ वेरी इंपॉर्टेंट रोल इन मैनेजिंग
Mm.
psoriasis. So does that mean that sun can also help?
Yes, definitely. So basically, sunlight can so brief or you can say a controlled sunlight exposure can help in treat managing psoriasis because sunlight, just particularly UV band therapy, UVB, it helps in decreasing inflammation and cell growth. But also, you can say the early morning sunlight of a short time, of maybe for 10 to 15 minutes, it's advisable to patients, but not strong sunlight because अगर strong sunlight से अगर patient can get some sunburn or allergy that can trigger psoriasis. So it's very important to have a mild or brief exposure, mainly in the early morning hours, which can also help in producing vitamin D, and this will help in eventually controlling psoriasis.
Doctor, once the treatment is done, once we are on maintenance therapy, does the skin becomes normal as it was before, या कोई scar भी छोड़ के जाता है psoriasis?
No, definitely. There is no scar left in psoriasis because psoriasis में skin का mostly upper layer involved होता है. So basically, we see inflammation, redness, and after treatment, you can see either it's getting controlled with either there is light patches or dark patches, but there is no scar get you can see in psoriasis. Just you need to control with a good amount of moisturizers on a daily basis.
Fair enough. Dr. Sagar, are there any practices that make psoriasis worse?
Practices in terms of, you can say.
Like using, harsh or very fragranted soaps, or not using
Mhm.
moisturizers, or using hot water shower, etc.
Yeah. So basically, in psoriasis, the skin becomes easily dry. It's easily dry and sensitive. So various harsh chemicals can or harsh soaps can aggravate psoriasis. Also, extreme hot water can trigger psoriasis, and so it's better to use a mild, gentle moisturizing soap. Mainly the scented bars, which have pH 5.5. It's very good in cases of psoriasis, and a good moisturizing lotion is also important. Yeah.
Okay. There are a few questions from our viewers that I'll take. One question by John Vergas is: can yoga or meditation help
Mm.
psoriasis?
Yes, definitely. So basically, in such lifestyles and routine, everyone is concerned about psoriasis, but also people should understand that stress is also one of the factor which can aggravate or trigger psoriasis. So such practices like yoga, meditation can decrease the stress levels in the body and also maintain a healthy balance, and it will help in controlling psoriasis.
We often say, or I should say, we always say that maintaining a good lifestyle, a stress-free routine where we can sleep well, where we eat well, etc. It makes a
Mhm.
big impact in our overall health, in our overall well-being. Now, keeping that in mind, डॉक्टर सोराइसिस का भी जैसा कि आपने कहा कि स्ट्रेस तो इस तरह की चीज़ों को एग्रेवेट करता ही है। दूसरी चीज़ें भी, वो हमारा लाइफस्टाइल हुआ, क्योंकि ये बहुत ही
Mhm.
सेडेंटरी लाइफस्टाइल है, सन में ज़्यादा एक्सपोजर नहीं है। इंडिया जैसी
Mhm.
कंट्री में भी विटामिन डी डेफिशिएंसी बहुत ज़्यादा बढ़ने लगी
Right.
है। वी आर मोस्टली
Mhm.
इनसाइड आवर एयर कंडीशन रूम्स, ऑफिसेज़, कार्स
Mhm.
एटसेट्रा, और डाइट, लाइफस्टाइल सब बहुत ज़्यादा
Obesity.
खराब हो गए।
Mhm.
ओबेसिटी इज़ अ बिग प्रॉब्लम। तो इनको
Mhm.
भी किसी तरह कंट्रोल करना, लाइफस्टाइल मॉडिफिकेशन, इट कैन हेल्प psoriasis?
Yes, definitely. So, the obesity and such lifestyle, which you are mentioning, poor lifestyle is a triggering factor for psoriasis and also for any chronic inflammation in the body. So, such good practices will definitely help in controlling psoriasis. And recently, we are seeing a lot of young patients developing scalp psoriasis, or you can say nail psoriasis, or palms and soles sites are involved. So, so in such patients, you can say if the patients are adopting a good, healthy lifestyle, so definitely they can also prevent psoriasis and also control on a long-term basis.
राइट। अभी आपने स्कैल्प सोराइसिस का जिक्र भी किया, और एक हमारे व्यूअर हैं अभी कुमार, वो जानना भी
Mhm.
चाहते हैं हाउ स्कैल्प सोराइसिस इज डिफरेंट फ्रॉम डैंड्रफ। एंड इसी के
Yeah.
साथ साथ डॉक्टर हम ये भी जानना चाहेंगे,
Mhm.
थोड़ी थोड़ी रोशनी अगर आप डाल सके, नेल सोराइसिस, सोराइटिक
Mhm.
अर्थराइटिस, इस तरह से
Arthritis.
अगर। यस।
Yeah, sure. So, first of all, scalp psoriasis is very much common in these days and very much misdiagnosed also. काफी पेशेंट्स है जो ओवर द काउंटर दे यूज द शैम्पूस एंड दे हैव बीन यूजिंग इट बाय you can say ketoconazole and normal dandruff shampoo, but with such shampoo psoriasis, scalp psoriasis cannot be treated. So the scalp psoriasis mainly get triggers in cold and winter climates. So because of extreme dryness, you can see flakes of skin, flakes, dandruff. Also, there is more dryness, so you can see the flakiness which is continuously coming out from the scalp. Now, that is a characteristic sign of scalp psoriasis. So in such patients, we have to treat it with normal, you can say, a good medicated shampoos which are having coal tar. This will definitely help in curing scalp psoriasis. Apart from this, the nail psoriasis patient usually don't come with directly with the nail psoriasis, but if the nail is damaged on a, you can say from long term, or there is you can say nail dystrophy or onycholysis, that is the nail is getting deformed, or you can say it getting get a nail is getting loose by its own. So such patients we can start the treatment. And the psoriatic arthritis, it's mainly the type of psoriasis in which you can see the joints are involved, and usually the distal joints of the hands and feet are most commonly involved. So patients come with severe, you can say, swelling, joint pain, mainly morning stiffness. And in such patients, we normally do an X-ray to confirm it and start the oral medications to control the treatment. Yeah.
Doctor, out of all these kinds of psoriasis, whether it's on the scalp, on the nail, on skin, or palm, or sole, or
Mm.
arthritic psoriatic arthritis, which one is the most, the one which affects us the most and also takes the longer time to get treated?
Right. So basically, you can say the palmar plantar or the nail or the psoriatic arthritis. This takes a long time to get controlled or treated. And also, the palmar plantar patients, they have, you can say, very much loss of, you can say, they have disturbances in doing the daily activities also. So they are, so it's better to treat at an early stage.
Hmm. कुछ हमारे व्यूअर्स ये भी जानना चाहते हैं, हाउ लॉन्ग विल आई नीड टू बी ऑन द मेडिकेशन?
Uh, so it depends on the patient's, you can say, the skin severity and condition. But for active control medications, we usually give for around maybe see 2 to 3 months for good control. And for maintenance, we can continue it for another 2 to 3 months. Yeah.
Right. Now, Dr. Makhija, with so much of advancement in terms of
Mhm.
technology, with the introduction of AI, telemedicine, etc.,
Mm.
are there any procedures or maybe exposed sun exposure or laser, etc., which is helpful
Mm.
in treating psoriasis?
Yes, definitely. So there's a good, you can say, phototherapy chamber, which is available in few clinics and also in the hospitals. So which
Mhm.
have a specific, you can say, ultraviolet band. So in such, if the patient is undergoing such sessions, maybe around 1 to 2 times a week also, and it will definitely help in clearing psoriasis and also give a long-term, you can say, long-term psoriasis-free skin condition for a long-term basis also. And also
Right.
if lasers, and there's a laser which is available in the market known as excimer laser, which has a specific wavelength of 308 nanometer. This also helps in treating psoriasis.
Right. So various procedures are also there that can manage psoriasis well. तो डॉक्टर, कई बार ऐसा होता होगा ना, आपके पास पेशेंट्स आते होंगे और आपको लगता होगा कि अरे अगर आप ये नहीं करते या इसको पहले दिखाते या अगर
Mm.
ये गलतियां नहीं की होती तो इतना कंडीशन नहीं बिगड़ता। तो ऐसी कुछ
Mm.
कॉमन मिस्टेक्स जो अक्सर लोग करते हैं psoriasis के केस में?
Yeah. So this is also very important question which every person knows to get knowledge about it. So the most common malpractice which is going on, that many patients visit, you can say, the normal general physician doctors or the local doctors, which on seeing the condition they get started on oral steroids. So basically, sudden withdrawal of oral steroids can trigger psoriasis, and we have seen patients which have taken steroids in the form of tablets or injection, and they have come to the skin doctor with, you can say, a full-blown psoriasis. So it's better
Right.
to consult a dermatologist here.
Okay. Now, Doctor, before we wind up the whole session, we would like you to tell us a few do's and don'ts, or what should
Mm.
we do to have a healthier skin, एक healthy skin barrier maintain हम कैसे करें कि psoriasis, दो although it's an autoimmune disorder as well,
Mm.
तो उस पे कई
Mm.
बार हमारा कंट्रोल नहीं होता, लेकिन फिर भी हम प्रिवेंट
Mm.
कर सके, हमें पता हो कि कब
Mm.
क्या करना है.
Yes, right. So, so the normal public should know what are the basic do's and don'ts in psoriasis. So पहले सबको ये पता होना चाहिए कि ये contagious नहीं है, ये फैलता नहीं है, skin problem, and this can be definitely, you can say, controlled on a long term basis. So on a daily lifestyle, patient can have good amount of sleep. A healthy diet is very important. Diet rich in omega-3 fatty acids definitely help in controlling psoriasis on a long-term basis. So patients can have, you can say, fish. They can have almonds, which are very good in such conditions. Also a good lifestyle in terms of, you can say, good diet, good exercise, moderate amount of walking, increase good sun exposure in the morning is very important in such patients. Don't forget that moisturizer is very important factor in psoriasis. So a good amount of moisturizer has to be applied daily to control psoriasis. Apart from this, avoid smoking, avoid alcohol consumption as it can trigger psoriasis. In the winter season, especially, apply moisturizers daily, 2 to 3 times daily, as a thick layer, which will help in controlling psoriasis. Whenever there is a new appearance of rashes or there is formation of skin condition, so it's better to consult a dermatologist that it can be controlled initially. uh, Avoid using oral the counter medications also, and avoid using any steroid tablets or any injections for this, as it can worsen psoriasis. So these are the most common factors which every person should understand. Also, there are certain medications which can trigger psoriasis, so patients should keep known of such medications. Like if the patients are on beta blockers, some antidepressants like lithium, such patients should be wary about psoriasis.
Right. Now, doctor, because you just mentioned about, how important it is to eat fish, nuts, etc., how important it
Mm,
is to, manage your plate, your thali cleverly so
mm,
that you get all the macro micronutrients. कुछ
yes.
हम कहें मिसकंसेप्शंस मिथ्स भी होते हैं। कई बार लोग कहते हैं कि फिश
Mm,
के बाद दूध पियोगे तो सोराइसिस हो जाएगा, या इस
mm,
तरह की और भी दूसरी बातें होती हैं।
mm.
तो क्या ये सच है, और दीज आर ऑल मिथ्स?
No, this is definitely a myth that any non-veg or any having fish with after milk can trigger psoriasis. Definitely not. So such conditions neither can, you can say, aggravate psoriasis or any other skin condition.
Thank you for busting that myth for us, Dr. Sagar Makhija. And thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting psoriasis. And in case if they get to see such symptoms or signs, they now know that instead of self medication, it's always better to approach a nearby dermatologist. It was great to
Yes,
hear from you.
definitely.
Thank you.
Yeah, yeah. Thank you so much.
So, thank you, Dr. Makita, and viewers. Thank you for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you, and have a great evening ahead. Goodbye.